The only borders that exist in the world today are the ones we have created. Diseases know no borders. They spread and kill without prejudice. It happened with the plague. It happened with the Spanish flu. It happened with SARS, but it was stopped before it could run its natural course. In a globalized world, people and goods are traveling more today than ever before in history. There are over 53,000 merchant ships over 500 tons on the oceans today. There are over 1,200 international airports in the world, with movements of almost 2 billion international passengers and almost 50 million metric tons of cargo per year. The International Health Regulations, or IHR, provides a legal and practical framework to protect against the international spread of disease. The purpose of the International Health Regulations is simple but very broad. The adoption of public health measures at ports, airports and ground crossings aimed to protect the health of the populations and to avoid the spread of disease and its agents through international traffic of travelers, conveyances, baggage, cargo, containers and goods without unnecessary interference with international traffic and trade. This requires the cooperation of governments, public health, port authorities and transport companies, and the development of core public health capacities. There are specialists worldwide being trained in how to make the world safe from disease. All countries are committed to maintaining or developing these core public health capacities. Time is not on our side. The world is getting smaller, and with daily increased movement, the threat is getting bigger. These regulations are legally binding for all WHO member states, and they are required to identify, assess, and develop core capacities for ports, airports, and ground crossings no later than June 15, 2012, in order to provide a safe environment at points of entry facilities, such as entry and exit controls, and arrangements for prompt assessment of suspected illness and medical care for ill travelers, trained personnel for the inspection of conveyances, programs for vector control, food and water safety, control hygiene conditions at points of entry facilities, to respond to public health emergencies. The work of the World Health Organization in revising and implementing the international health regulations with its member states will guide us to a safer future. Come on board. We're all in the same boat.